Thank you.
How do you decide when making priorities between what is urgent and what is important or essential?
That's probably the easiest question for me, being a nurse. In the hospital setting, the priorities are emergencies. And during my time working in hospitals early in my career, I somehow always ended up on the code blue team. So that meant when a code blue was called, you dropped whatever you were doing and you went to that location and you did what was expected of you. In the meantime, someone was always still on the floor taking care of your patients. In the school setting, where I spent 21 years, some people think a school nurse is just there to put on Band-Aids and give an occasional hug. It's a lot more than that. We did have concussions, we did have fractures. I think the most difficult thing for me to deal with was seeing how children were being mistreated and abused. And I soon became an advocate for children and worked very hard to enlist Jenny Murphy-Shiflett and her staff from SARCC to come in and do educational programs. I also always had to deal with headlights. And that was challenging. I would come to school all prepared to do all the mandated screenings. And I would get a phone call from a parent saying, I found headlights. Well, that was the end of my screening. And that meant I had to check that child's classroom, that child's bus, and then the entire school. And I was one nurse. Then I would get the parents in, I would try to educate them on what they needed to do. Most parents were very diligent. There were parents who failed to clean up their kids. And I would go to the home and try to help them. And if that didn't work, then I had to call on the services of children and youth with another student nurse, and we started making phone calls because we thought that there should be music on the wards. We had many patients that simply spent 20 hours out of 24 rolling up and down the hallways. And we all know that music soothes the soul. So we made phone calls to elected officials, and we took our own time and networked with some community organizations, and I'm talking about 52 years ago. And by the time we left Warren, we had a hi-fi player on every ward. So I think that's when I really decided one day when I grew up, I would be an advocate for mental health. And that's one of the reasons I'm still serving almost 40 plus years at Warnersville State Hospital. Another example in the school setting, and I was the school nurse at Union Canal. The staff and the parents recognized the need for services for our children who were socially not up to par, who were dealing with all kinds of issues that required medication. I talked with Dr. Fran Sparrow, who's the adolescent, child, and teen psychiatrist at Haven. I talked with children and youth, various home agencies that go into the home and provide services. And together, we put together the school-based mental health program. And this meant that the children received these wraparound services within the school setting. They were not ostracized out of that setting to receive these services away from the schools. And 21 years later, that program is still in place and has been very successful in this particular school. And as Jenny and her staff knows, we've been advocating and collaborating for how many years to get a children's resource center in Lebanon County. And praise the Lord, that happened this summer. And so it really does work if you're willing to do the work to bring all these people together and to advocate in a positive way for these kind of needs.
I'll also add that for
me, it's patience to understand why people don't see the big picture. And also, sometimes, and I really don't like admitting this, but I wish I were a little more harsh. I try always to give people the benefit of the doubt, when sometimes I should just say, you know, this isn't going to work, that's it. And, you know, I have a lot of patience with the elderly and with the children, I lose patience when I look at our community and realize that we're not doing enough with our children to teach them about their responsibility and how they can play a role in their communities. You know what? They are the future. And we need to really do a better job of getting children involved and being a part of the community.
Very good. Okay, we're going to ask one last question, and you all, what is the biggest challenge facing leaders today?
For me, being involved and volunteering with nonprofits, the biggest challenge is securing funding to meet the needs of the people we're trying to serve.